Welcome to CrackTalk.
Hey everybody, how you doing? And welcome to this week's episode of CrackTalk. You got Dr. J here, and I got my sidekick, Scott. What's going on?
Not much, my man. Not much. Excited about another episode.
Here we go, and I'm telling you what, we got a doozy today. I've been in the actual clinic today treating patients, and it has been one after another that have been experiencing or currently experiencing exactly what we're going to talk about.
Awesome.
But make sure first, before we get started, if you like the content we're pushing out, share this vibe out to everybody. Share this link. We're trying to bring the Riz, okay? And the next thing, subscribe. Like us, make a comment, share it with everybody you know that could benefit from the intel that we're bringing.
Got it.
So today, Scott,
What are we talking about?
carpal tunnel. Carpal tunnel, and it's a big one. Here's the deal. I didn't understand, because I'm telling you, Scott, in the clinic, so many patients are coming in and saying, "Oh, I've had that carpal tunnel surgery.
Right.
Or I did the elbow nerve release because it was supposed to help. After I did the cut here, I did it here. Then they said now it's in my shoulder or it's in my neck." And I said, "Well, are you still dealing with?" "Yeah, I'm still getting numbness, tingling." So the symptoms of carpal tunnel are, by definition, you have numbness and tingling in your hands and your wrist, and you have weakness. Like you go to grab this pen and you can't hold on to things. So how prevalent is this? Incredibly, 1 to 5% of the U.S. population deal with carpal tunnel syndrome.
Wow. I knew it was a lot. I hear this phrase thrown around a lot in the clinics.
All the time.
Of people coming in, it's like, "Oh, I had carpal tunnel." And like you said, most saying, "I've already had the surgery."
Had the decompression surgery.
Yeah.
Here's what's crazy. Every patient, and I didn't put this together until I started doing the research for everybody here, it's a 3 to 1 prevalence rate for women over men. So everybody that I've had in the office today and yesterday, all women complaining about carpal tunnel syndrome.
Wow.
So women, you have a problem. You have carpal tunnel syndrome 3 times greater than men. Sorry about that. But I think it's kind of like, so I started kind of peeling back. I said, why is that? I said, most women are taking care of kids or they're doing desk-type jobs, and we're going to get into the ergonomics and how to prevent carpal tunnel on the later part in our action steps. Because once again, I want to remind everybody, we want to get you educated. We want to get you fired up and inspired that you don't have to live today with carpal tunnel syndrome. And then we want to give real practical action steps at the end of this so you can live a happy, healthy life without, in this case, carpal tunnel.
Awesome.
All right. The other part, 1 in 10 workers, people that are actually in the workforce, 1 out of 10. That's 10% of people that aren't sitting on the couch that are actually in the workforce are dealing with CTS, carpal tunnel syndrome.
Wow.
So if you're a worker and you're dealing with carpal tunnel,
huge number.
Huge number.
That's a huge number. I mean, when usually you throw, it's like 1 out of 10. I'm like, what?
1 out of 10 in the workforce are dealing with carpal tunnel syndrome, aka CTS. So 1 to 5% of the population is dealing with it. But even greater than that, if you're at work and you're actually doing a job, you are now have a 10 times, 1%, 10%, that's 10 times prevalence rate of getting carpal tunnel. Now, what is carpal tunnel?
Yeah.
It's when the nerve going to your wrist, your median nerve, gets compressed at some level from the kinetic chain. And I want everybody to listen to what I'm saying. It just doesn't happen at your wrist. Carpal tunnel syndrome is weakness and numbness and tingling, Scott, in the hands and the wrist, with weakness, okay? Now, here's what I want to explain to everybody. This is why I got a little fired up about this talk today, is because we see a tremendous amount of misdiagnosed carpal tunnel syndrome where people have the decompression surgery in their wrist because they've done an isolation surgery. Right here it said, okay, your hand's going numb because of that median nerve is being affected here.
Right.
Well, that is one. I want everybody to listen to this. That is one way carpal tunnel syndrome can exist. The other, you could have the nerve entrapment in your elbow. And I'm going to go in a little bit more physiologically deep here. The nerve comes through here that goes down to here. So it can get blocked here. So you'll see people, they have a little scar where they've done an elbow decompression or an elbow release. Shoulder, it could be occluded here. Pec minor. So people's shoulder could get rolled forward. A lot of bodybuilders get this. the shoulders are rolled forward, or power lifters, better example. They're lifting a lot of weights, their pec gets real strong, their back is not as strong,
Right.
so their shoulders roll forward, and next thing you know, they have what's called pec minor syndrome or a thoracic outlet syndrome. That nerve and blood flow is affected right here in the shoulder.
Okay.
Now the nerve impulses can't get down the arm to the elbow to the nerve. So, but it presents as weakness and tingling in the hand. But the nerve is affected here.
Got it.
You could have a first rib. That's right here. Another type of thoracic outlet syndrome that's occluding the blood vessel and the nerve. So if you're having these type of symptoms, it could be one of those three. The greatest one that I see, it's not even in the shoulder, it's not in the elbow, and it's not in the wrist, Scott. It's coming from their neck. So what most people don't understand is the 4 or 5 segments in your neck, C2, C3, C4, C5, comes out and creates what's called the brachial plexus.
Right.
The brachial plexus, those nerve roots come off, and they come up and they kind of make this rope that starts coming down your shoulder, down into your arm, and then it kind of spider webs out into everything here. So if you have any type of disc unleveling, where the disc actually goes from here to here, or if you have any type of bone spur, or any type of degenerative arthritic syndrome in your neck, where those nerves are affected. Scott, what do we always talk about in the chiropractic office? Subluxation. Bone moves out of place, puts pressure on any one of those 4 nerves on each side, can affect any one of those nerve roots, and as it's coming down, can manifest as CTS.
So you're saying if you had a subluxation, pressure on a nerve in your neck coming out of that brachial,
it could present as CTS.
It could actually present as carpal tunnel.
Yes. So what we're talking about today is if it is carpal tunnel, true carpal tunnel syndrome, where the median nerve is occluded by one of your carpals, right here, where the carpal falls, it's putting pressure on that nerve, just like we talked about in the spine, putting pressure on that nerve, it now makes your hand weak, numbness, and tingling where you can't use it.
It's just happening in your wrist.
Right here. That's classic carpal tunnel. Very easy surgery. They go in there, they clean out the scar tissue,
off.
they do what's called decompression surgery. They wrap it back up, the hands come back alive. What I'm seeing is in the office, once again, people that have all the cut marks.
Right.
And it has now worked up where now they're talking about having surgery here, surgery here, but then I'm looking at their x-rays, Scott. And for you that know this, in the chiropractic office, we take x-rays of the neck, the mid-back, and the low back because there is no segmental difference between those areas, and we want to know how it's all interacting, how those 24 bones are moving. Are they in place, out of place? Do you have gross subluxations? A loss of the curve in your neck? Has it when it started going straight or the other way, which we're seeing a huge prevalence rate on because of screen time, people looking down. Okay? Scoliosis is another gross subluxation where the bones start bowing out to the side. They should be stick straight, they start going out to the side. So we look for those things. All right, but we use x-ray to really let us know, okay, how much degeneration, do they have bone spurs on the front and the back of the bone? Is the disc height, even from front to back, and is it celebrated, and are all of them uniform? Which means, okay, they don't have degenerative arthritic changes. They start having degenerative arthritic changes, I'm telling you, every single one of the patients, this is for each one of you, every single patient that said carpal tunnel surgery here, I looked at their neck x-ray.
You saw it.
They had either a straight neck, reverse curve, they have already bone spurs, they're probably in phase 2 to phase 3 degenerative arthritic changes. Now you're talking about people in their 40s, 30s, 60s.
So let me ask you this. So I was going to ask you, as you're saying this, what's popping in my head is then what causes this? So, and you made the comment of phones, screen times, and you think of since the onset of computers in the workplace, even
100%.
in the old days, typewriters and things like that is where you have ergonomics of sitting at a desk like this, repetitive motion.
I would say carpal tunnel was an issue. Probably a lot of farmers, people who were working in factories, that they were turning wrenches, but it was so low on the prevalence rate compared when people started sitting down, and like you just said, and going to typewriters. The worst thing now, we're going to talk about this when we talk about action steps, is mouse ergonomics for your computer and keyboard ergonomics. Those are two of the largest contributing factors to carpal tunnel. Could it be
compounded? So if you've got repetitive motion, say wrist getting compression here, and then also say, first thing that's popping up is somebody showed me a picture of myself. This was last week. Somebody took a picture of my living room, and I just happened to be sitting on the couch on my phone.
And were you hunched over?
Oh my God. So this is something that I kind of pride myself. Like, look, I work in the chiropractic industry, so I sit.
I got the good posture.
I do all the ergonomics correct. I'm sitting there, Jay. I'm like all hunkered down, got my phone here. So I'm just thinking over the years of working on a computer, sitting back, also doing the mouse, so they can actually.
You also work out, so you do a lot of chest,
the rolled shoulders.
The rolled shoulders.
Yeah. But that's wild to think about. As you're working, you're doing what you do. You could be causing effect here in your neck. Shoulder, elbow, and wrist.
Okay. So when Scott, you're leading me right into the next thing. So when you go to the chiropractic office, what are they looking for? First, they're going to identify: are you having weakness in your hands?
Right.
And numbness and tingling. Okay. You have carpal tunnel syndrome. Okay. Now let's identify where it is coming from. So what we do in the chiropractic office is we take X-rays of the neck. We look for contributing factors: arthritis, reverse curve, subluxation, those type of things, degenerative arthritic changes, bone spurs, loss of disc space, that kind of stuff.
Right.
Then we look at the shoulder. Okay. Then we look at the elbow, and we look at the wrist. So we don't just look at the wrist. See, a lot of doctors go right to the wrist because say, "Oh, your hand's numb and you're weak."
It's got to be this.
Oh, it's got to be this. Well, it can be. But I'm telling you, more times than not, it's more up the kinetic chain, or it's a combination of all these factors. What I love is on those patients, we're adjusting their neck, their shoulder, their elbow, and their wrist. We're making sure these areas are clear. Now, if they still have carpal tunnel syndrome, a couple months after treatment, and they're still having numbness and weakness, they have classic carpal tunnel. They are possibly going to benefit from the decompression.
Well, I want to bring up just a point of what you just said, and this may be something as a viewer, if you've never been to a chiropractor before, and just think of it as the traditional neck, back adjustments.
Yes, that's why we have this podcast.
Well, you made a point, adjusting the neck, looking at that area, the upper cervical neck. We adjust shoulders.
Yes, we adjust shoulders.
Elbows, extremities, and wrists.
Yes.
So that is something that a lot of people may or may not know, that a chiropractor, anything that moves, a joint is a joint, right?
Yeah. So, and they need to be in alignment.
Right.
Because if they're not in alignment, just like anything else, they're going to wear out faster. But bigger than that, if a joint is out of alignment and it's creating inflammation or rubbing that nerve, we've already talked about the weight of a dime.
And it can decrease, and it can cause it somewhere else in the body.
100%.
See, that's a huge point.
Yes.
That actually I really didn't know till just now. Is thinking about having almost a subluxation, weight on nerve happening in a joint, be it an elbow or a wrist or a shoulder, and knee, something like that.
Yeah. So people get sciatica, and they can have sciatica for multiple different things, which is, we need to do a podcast on it, which is the sharp pain shooting back down the leg, because that being caused by a lot of different things. I'm going to tell you though, I mostly identify it comes from the spine. And I'm going to tell everybody that's on this podcast today, listen to this Crack Talk. If you have carpal tunnel syndrome or the symptoms of carpal tunnel, and you maybe have had the surgery, it's not too late. You still have a lot of opportunity. If you have not been to the chiropractor, or even if you've been to the chiropractor, I would first and foremost challenge you to get back to another chiropractor, get a recommendation, a chiropractor that...
And get an x-ray.
Get x-rays, and a chiropractor that does also not just treat the spine, but also treats all the extremities or kinetic chain of the arm. All right, get in there, let them take x-rays and see what's cooking.
Yeah.
And I'm going to tell you, just like today, I took every one of the patients, said, your carpal tunnel, I'm going to tell you right now, matter of fact, it is coming directly from, partially, could be a combination of multiple events. It is started right here in your neck.
You can see it.
You can see it 100%.
And you made a great point again that I want to kind of reiterate, the fact that if you have had surgery, if you're watching this and
it's
you
not
have
over.
had surgery.
It's not too late.
It's not too late. Because I don't want anybody to think, well, I've already had the surgery, so there's nothing I can do. I just got to live with it.
Well,
no.
Scott, I've heard out of the 6, 7 people, probably 2 to 3 that have said, I've been having to just deal with it. My doctor told me I had to live with it.
Yes.
And thank God I found this office because this is the only thing that gives me a relief. And the biggest thing that gives them the relief, Scott, was when they got their neck adjusted and they did the decompression of the neck.
Wow.
So I just want to impress upon everybody, this isn't rocket science. Sometimes I think people make chiropractic this big behemoth. It's very, very simple. We take bones that are out of place, we put them back in place, we allow the power that made the body heal the body. If nerves are affected, they're going to be hypertonic. They're going to send too much information. If they're affected, they can send too less information. They can stop sending information.
Right.
One of those 3 things are happening. So our opportunity...
And it will manifest in some kind of a symptom.
Over Time too. The other thing that I think everybody takes out of the equation of healing, I know they do, because I talk to so many patients, they want that one adjustment, they want to be fixed. You've had carpal tunnel or you've had X condition for 40 years and today
but they want you to go. I guess it's like, well, I don't feel any better.
I always said the joke was, I'm not Benny Hinn. And I don't know if you remember Benny Hinn.
Yes.
He's that minister that would slap you on the forehead, you healed. And then all of a sudden they would have walkers and canes and everything. We're not doing that in the office, but we understand that, hey, the body heals in rhythm, all right? It's just like going to the gym. Muscles are built, ligaments, tendons, and muscles are also healed in rhythm. That's why physical therapy is usually 2 to 3 days a week. Chiropractic is 2 to 3 days a week. Why you come? Because I always get that question. Why do I have to go to the chiropractor so much? We're dealing with the body. Right. You know, and we're dealing with physical problems. We're dealing with joints, muscles, ligaments, and tendons. You guys get that? We are just a big bag of chemicals. But I'm going to tell you this, Scott. Currently, the paradigm has shifted to where people just want to throw a chemical solution at a physical problem. Doesn't work. You can't take enough Neurontin to have carpal tunnel go away if that nerve is affected.
Right.
You can't take enough muscle relaxers to kill it. You can't. You can take probably enough painkillers until you become an addict, so where you just don't feel it. But that doesn't mean that the problem has resolved. So we want to just impress upon everybody that's watching this Crack Talk and our patients that are inside the chiropractic office that there is a better opportunity than drugs, better opportunity than going and getting cut on.
Right.
And I'm not saying those two things aren't necessary sometimes,
right.
but I'm just saying that should be the last thing, especially the prevalence rate of addiction, especially the prevalence rate right now of post-surgery complications. You know, we see in this office, anybody that's had a low back surgery, 3 to 5 years after they have a low back surgery, they're back in here in worse pain, and now they have scar tissue, and it's exponentially gotten worse. Same thing with surgical. You cannot even believe the amount of surgical plates and lumbar laminectomies I have seen just in the past few days.
Wow.
It has blown my mind. So surgery's real, and it's out there, and I'm not saying it's unnecessary. I'm just saying we need to make the most conservative approach first. And this is one of the stats I got. Carpal tunnel syndrome, CTS, 70 to 90% of people diagnosed with it responded exponentially favorable with conservative rehab, which included chiropractic care. I know this for real. We have patients that come in, they feel like, oh, I got to live with this the rest of my life. I've never been under chiropractic care. They've already been cut on, and they can't even believe the amount of relief they get, Scott, when we start adjusting their neck, their shoulder, their elbow, and their wrist. They're blown away.
Unbelievable. I wonder what the stats are the other way. You know, I don't know what that would be as far as surgery.
They usually go in and they do another decompression surgery. So let's say if any of you that have had carpal tunnel syndrome surgery, the decompression, you know what happens. They go clean it out once. Couple 5 years later, scar tissue builds back up. They say, Scott, we're gonna have to go back in there, clean it back up. Or let's do an NCV, nerve conduction velocity test, to see where the blockage is. And often it shows all 4 areas, the neck, the shoulder, the elbow, and the wrist. And now they'll look, okay, well, let's see if it's here. They've even went as far in surgery to remove people's ribs and to cut their pec muscles because their thoracic outlet syndrome is making their arm so numb and so weak that they can't use it.
Wow.
And I've never been at a point where I couldn't use my hand or my arm. I've had a couple of stinger bruises where I've kind of had a trap muscle that didn't let me use it. You know what I'm talking about.
I know all about
you feel like you got the flu and you feel like you can't move. But I've never had it to where I grab something and it drops out of my hand like a coffee mug. Okay, so I'm very sympathetic to all of you that are possibly dealing with this. And if you know somebody that's dealing with them, get this podcast in front of them. Because if anything, you want to get out of today is our first action step is what? Get to a chiropractor.
Right.
Get into an office to see a doctor like me in your surrounding area that takes pride in getting people out of pain and discomfort and getting them well so they can live a happier, healthier life. But by way of doing that, we do a full consult. We do a freaking intense orthopedic neurological exam. You know how intense that was. Taking x-rays is absolutely imperative to see what's going on with somebody's anatomy and physiology. Because I mean, you could miss a lot. I've seen 3 patients in the past 2 days cancer on x-ray. Fibroids, some believe some knew they had cancer, but we see stuff. You know, we see post-surgical stuff. You got to see, is it stable? If somebody's had low back surgery, if it was one of you, would you want the doctor to know if that area was stable enough to be treated or not stable enough to where you might need to go back to who initially did the surgery.
Right.
So those are the things I'm telling you, when you're looking for a chiropractor, you need to be identified. And then you need to ask them on the phone, do you guys help people with carpal tunnel? The staff will tell you, oh yeah, we have about 20, 30 people that are coming in right now with carpal tunnel that we're getting great results. So first action step is what, Scott?
Go see a chiro.
Get into a chiropractic office, get an exam, get x-rays, and start getting treatment, okay? And I would say you need a minimum of 3 to 6 months of treatment where they're adjusting the neck and doing full-out rehab too. They're doing some associated physical therapy type stuff on all areas of your body to see if the carpal tunnel symptoms
are going away,
will resolve. And I'm telling you, you're gonna be blessed and possibly surprised. If you have it, here it is too, man. Computer, keyboard, and mouse.
Yep.
If you're working at a desk, you have got to be cognitive of the fact, are you like this? Are you using a mouse like this? You've got to get your wrist to where it's not in this space, right here. This is bad. This is why they make cock-up splints for people that have carpal tunnel. Really? This is bad. If you're on your mouse and your mouse is like this, or your wrist in this position, you are possibly going to occlude this area. Scar tissue is going to be built up. Also, what happens is the tendons thicken. They shorten and they thicken, and it puts direct pressure on that median nerve. Bam! You have carpal tunnel syndrome. The symptoms in your hand. So making sure that wrist is flat. You know, we have a really cool mouse out here. It holds my hand like this. You see that?
Yes.
I hold it.
I worked with a guy yesterday.
It's a little funky.
It was wild. It was like this. He's holding it like this and clicking his mouse. I'm like, what is that?
I have two of them back here. I'm going to tell you, at first, I thought I was using the mouse with my left hand. Now I love it because there is no wrist strain. There's no elbow strain.
I watched him all day. He's working on the side. I'm sitting there like this and then typing like this at the desk. So everything that you just said, my wrist was like that all day yesterday.
So you'll have a higher prevalence of being the 10%ers that are going to have some type of carpal tunnel syndrome symptoms, right? And the guy holding his mouse like this, everything's straight. Yeah. There's no nerve occlusion.
Well, what's interesting is I've actually done that where you're talking about lifting weights earlier and hurt shoulder or will pull your pec or something that. It pulls that shoulder over. And man, I have had it to where my hands will go numb. You'll get that numbness, tingling and stuff in your fingers, and I will go have I will go have one of the docs adjust, and they'll actually adjust my neck and do the first rib. Yeah. And then boom, it goes away.
See, did you all hear that? Exactly what we're talking about. But if you're not going to the chiropractor and get that adjusted, I'm going to tell you, you would have surgery on your wrist, your elbow, possibly your shoulder, and then possibly your neck.
Right.
Over a series of 10 years if the symptoms didn't go away. But yet, one adjustment, boom, bang, bing, all of a sudden the numbness and tingling goes away. Our bodies, and I can't impress the people on enough, in the office and on this podcast, our bodies are self-regulating, self-healing mechanisms. You just have to give it the right stuff. You have to give it the right opportunity to heal back from some of the nonsense that we put on it. Because, I mean, listen, if you're at a desk all day, it's hard. Your rip sticking. I mean, I'm watching myself right now do some of it. That's why I'm watching my keyboard. We have standing height desks. My hands are like this.
Yes.
They're not like this.
Yes.
I have to really watch that stuff.
Yep.
Because I bring my chair lower. So my hands, ergonomics in the workplace. Also, if you're pulling a lever or you're doing some kind of you have got to do strengthening and stretching exercises, which is another one of my action steps. You've got to be doing the stretching like this.
Right.
You've got to stretch out. I mean, right there, I can feel like I've been treating people today.
Yeah, I can feel that.
Because this is the opposite of this. This causes carpal tunnel. This relieves the carpal tunnel symptoms.
If you're actually working at a desk or watching this at work, you've been working, do that little maneuver right
Try to straighten out your elbow too, like this.
Just try to straighten it out like this, and man, I tell you what,
you'll feel it right there. Scott, guess what? Right there. Guess that's where they do the elbow surgery. Right there.
Really?
Yeah. And you'll feel it. You can feel it pull.
I can feel it because I've been at my desk all day today typing, so I can feel it in my wrists so much. Yep. Oh, now this one, I got it there.
Yeah, you can feel it really quick. So that's why they go from here, then they move into this area.
Interesting.
Right? Wow. Yeah, so pay attention to this stuff because, this is stuff that's going on in everybody's life. I just had a guy today, really jacked dude, bodybuilding and powerlifting. And he's done a tremendous amount of research. He's found out like all these power lifters and bodybuilders start having numbness and tingling in their hands. They lose function of their arm. Where's it all coming from? Their neck and their shoulder. So be very mindful of what we're talking about today. If you're going through some of these symptoms and start peeling back the layers, Is this happening in my life? Also, rest and recovery. With carpal tunnel, you can't be pounding on a computer or you can't be using that mouse in this position for long periods of time. If you do, you're ergonomically putting your body at risk of having carpal tunnel syndrome symptoms.
Yep, and I know that's hard for everybody to do.
Very hard, very hard. You know, we're all ripsticking. I will tell you the majority of people are not working at an ergonomic type of workstation in the first place. So make sure you identify and you go through your workspace. Talk to your boss, talk to your manager. You might need another chair. You might need an ergonomic mouse. You might need the mouse. You might need the ergonomic keyboard. You might need a desk that raises up. I have that one now, and it's kind of changed my life, kind of helps my low back too. I go from a standing to a sitting position now. So that's what we got for you today. So carpal tunnel. 1 to 5% of the population. If it's you, I'm sorry. But there are things you could do, and there's hope for you. If you're a worker, you have a 10% increased likelihood that you're going to get carpal tunnel syndromes, symptoms. And it doesn't just have to be surgery and medication. Understand that. Get to the chiro, start rest and recovery, stretch and strengthen your wrist. All right. Also, what was the other one, Scott? We talked about ergonomics. And ergonomics are, I think, one of the biggest things that are missed. I even watch it with myself here in the clinic. It's just,
I'm watching.
You fast. You want to go fast. You want to get it done quick. You don't have time to think about this, and then bam, you have an injury. And now it's something that you have to take time to get handled. All right, so that's our podcast today. Scott, you want to add anything on carpal tunnel syndrome?
Other than just, every week we come and I always get excited just because the message of, if you're dealing with something, start out, hopefully we'll educate somebody out there to say, hey, let's start with the chiro first.
Conservative rehab.
Let's a conservative way. Let's look at this and see what's going on. Is it a subluxation, a nerve issue in the spine, in a joint, something that could come out and have an amazing impact on a person's life without going through that road of drugs and surgery.
Those two roads, they should be the least traveled down roads.
100%.
Everybody that comes in this clinic that has had a surgery, the pre-surgery, the surgery, the post-surgery, I'm telling you, it's an act of God to come back from it. I had one woman, she had surgery on both hips. It took her 2 years to teach herself how to walk again. I just look at it, I'm like, oh my goodness, what we could have possibly done if you got in here before you had that, just absolute massive surgery.
I had a great phone call this morning, person looking to schedule at one of our clinics, and that's exactly what they have, an appointment date to go in and have something done. And they were like, hey, I just wanted to come in.
It gets real quick.
She was like, I want to come in and just see if there's anything we can do. She starts explaining the symptoms, sciatica issues.
Sciatica.
And I am like, look, I know where you're at. As I get your butt in here today. As like, I feel very confident that we can help you with this. And I told her to stay up with me. I was like, I want the success story. I want you to go in, get relief, and be able to say, hey, you know what? I don't need that appointment today. To go get this.
Cancel the meds.
Done.
Cancel the surgery.
100%.
And we're not telling people to do this off the spur, but we're talking about, listen.
That should be the last resort.
Hopefully you can go into a doctor's office. They do conservative care, and your sciatica goes away. Or in this case, carpal tunnel symptomology. So Scott, great having you on the Crack Talk today. Remember, like this, share it with everybody, make a comment, make a fuss about this thing, because we are trying to deliver unrelated topics and then relate them back to chiropractic and understanding that your body was made to heal and be well. And if you're in pain, I'm telling you, it's completely unacceptable to me, Dr. J, and to Scott. By our brand that we stand behind and the profession that we stand behind, we know we can help people.
100%.
So it just takes you to take the opportunity to step into the clinic, take an opportunity for yourself, for your family, because I'm going to tell you what, that's the other thing that I've just seen in this office. Is when somebody's in pain and they're dealing with somebody, it's not an individual. If they're married, if they have kids,
there's a ripple effect.
But Scott, what's cool about it is it has the opposite ripple effect. When you start I've seen so many families in the past couple of days. So you start pouring life into somebody, and that carpal tunnel goes away, or those headaches go away, or that sciatica and that patient you're talking about go away. All of a sudden, the entire family starts to live again, and that is the opportunity we want for each and every one of you. So Scott, thank you for this week's episode of Crack Talk. Hope to see you guys next week. Have a great week. We'll see you next time.
See you next time.